Welcome to the Health Focus Podcast, brought to you by Memorial Healthcare, where we discuss current trends and topics in healthcare that are important to our local Shiawassee community. We are coming to you, as always, from the Now Building and our podcast studio. As always, I will be your host, Dr. Gregory Flermone, a general surgeon here at Memorial Healthcare. With me here today is Selena Hafner. Today, we're going to be talking about exercise physiology and how it incorporates here at our Now Building. Selena, thank you for joining us today.
Hi.
Why don't you introduce yourself, tell us a little bit about yourself, tell us your credentials, and kind of what brings you here.
All right, so my name's Selena Hafner. I'm an exercise physiologist here at the Now Wellness Center. I graduated from Central Michigan University. My bachelor's was in kinesiology, and then my master's is in clinical exercise physiology.
Excellent, excellent. What brings you to Owosso? Are you from the area, or just, I don't want to say a job brought you here, but is there any connection to the Owosso or Shiawassee County?
Yeah, I grew up in Chesaning, so I didn't live too far from here, and I've had all my kids at Owosso Memorial, so I've loved the care I got here and just knew it was a good opportunity to move here and start my career as well.
Perfect, excellent. So let's start out kind of with some basics and the obvious. Explain to us, what is an exercise physiologist?
Yeah, so exercise physiologist, there's kind of three routes you can pick in school. Here we are both clinical and as well as health fitness, so we are college educated. Our whole bachelor's degree is around clinical work or, like I said, the health and fitness route. You can do strength training, conditioning. So we work clinically as stress testing, and then now once we switched over to the Now Building, we work more with our phase 3 program. So people outside of physical therapy, people with chronic conditions, we really dive more into health history and then develop a prescription based on like the person's health history, injury report, anything like that.
Okay. Do you see patients in an office setting, or is it pretty much just in the gym, in the workout area, kind of, watching them go through the motions? How does, if somebody wanted to come to you to say, hey, I need some help, kind of what does an appointment look like?
Yeah, so if you come to us and you want help, we'll kind of ask you if you need us first. So a lot of the times you can do a personal trainer, but if you have high blood pressure, high cholesterol, maybe you had a bypass surgery in the past, we'll schedule an assessment with you. We'll sit down one-on-one and just ask you about your medications, any current symptoms you've had, what was in your past. Like I said, if you've had bypass or maybe you came from physical therapy post-knee replacement. So we'll go through your history first, and then we'll take you around the gym, see what works for you and what doesn't. So basically, we'll go over like how to start your warm-up, what exercises are good for you, and we work closely with our physical therapists, especially if you came from there. So we have like a list of exercises that are do's and don'ts, maybe post-hip or post-knee. So we'll make it individualized to you based on what you're comfortable with and where you are at in your fitness level.
Excellent. Now, is this something do you see these patients one time, or is it kind of an ongoing process? Can they graduate from your program, or like they've got it themselves? Kind of how does that work?
So your first time assessment is with us, but then we're in the gym Monday through Friday until roughly around 3 o'clock each day. So we always tell people, we'll do your first assessment. We'll help you develop the beginning program. But then after that, let's say you've done your program from 2 weeks and you're like, all right, it's no longer challenging. We'll help you advance the workout. So you can come to us whenever you want help as long as we're here. And then you really don't graduate necessarily out of our program. A lot of our patients came from either phase 2 cardiac rehab or they're coming from therapy. So that's why we're the phase 3 graduated program. So it's assisted. We're on assistance more than we are one-on-one.
Okay.
So you can utilize us whenever you want as long as we're in the gym.
All right, excellent. Now you keep saying us. Is there more than
yeah,
one of you
sorry.
here? No. Is there more than one of you here at our center? And
Yes, Janelle, she is also one of the exercise physiologists that works here. So she's been here for, I believe, over 5 years. I've been out here for about a year. Okay. We both have good clinical backgrounds. I'm a little bit more, I've done clinical, like I said, as my master's, but I'm also like a personal trainer. I have a couple different certifications in like nutrition and like a Girls Gone Strong one is specifically made for women through different phases of their life. So between the both of us, there's a lot of experience there.
Excellent. Now, I keep hearing you mention phase 3. So we have a phase 3 program here. Kind of what are the different phases and what kind of patients fit into those?
Yeah, so phase 2 cardiac rehab, we'll start with that, is you're in the hospital, you're hooked up to an EKG. They take you through the workout. I believe you get roughly around 30 visits. So it's after you had a heart attack, after you've had a stent, something like that. So you'll do your phase 2 in hospital under the supervision of like a nurse here at Memorial. Once you've graduated, maybe you're still unsure how to work out by yourself. So what you can do is come to our phase 3 where we can monitor blood pressure, heart rate, oxygen. For example, even one of our patients went into an arrhythmia here this morning. So we were able to get her out of that arrhythmia, tell her what she needs to do, whether it's go to the ER, which is thankfully a benefit of coming to this gym. If something does happen, you're across the street from somebody that can help you even more. So our phase 3 program focuses on how to live with a condition after you have it and after you've graduated from either physical therapy or cardiac rehab, or just in general, how to develop a good fitness routine.
Excellent. So what benefits do you see in these people? Are they able to get off medications, or is it core strengthening so they don't fall down? Kind of what benefits or what are your goals with these patients outside of just making sure they're working out properly? Like, what are the end goals?
Yeah, we've helped a lot of people get off blood pressure medication. So a lot of times after you've had the high blood pressure or anything like that, diet and exercise is, I guarantee, something that you can do with every condition you have. I mean, even our Parkinson's patients are here doing different programs that they've had here. Boxing is good for Parkinson's. So exercise in general can help you get off some medications, but the goal is to let you live a long, happy life without hopefully pain and things that you can do by yourself. I think for my goal for like patients here, the older ones, I hope that they can live outside of this without going to a nursing care facility or needing help with everything that they need, like carrying groceries or anything like that. So they do get stronger here. And I think my biggest thing is getting rid of stigmas. I think older people think, well, I'm 60 or whatever it is, I can't lift weights anymore. And I think we've kind of switched that. So we've brought in different classes to help people lift weights for the first time in their life, and they're like, oh yeah, I can do this. So I think it's breaking the stigma, letting them know like age is just a number, you control what your life is, and helping them get off medication, just feel better about daily living.
Excellent. So it almost helps keep their independence some too,
Yes.
which is, as people get older, is very important. Now, you kind of mentioned this, group fitness.
Mm-hmm.
What type of classes do we offer? Kind of, is that included with the gym membership, or those extra? Kind of, what all do we offer here at Memorial?
Yeah, so all of the group fitness classes are offered in your membership. There are no extra costs other than one swimming arthritic program. So for, what me and Janelle actually brought in was we noticed a lot of our seniors couldn't do a lot of the classes, so we developed chair classes. We offer those 5 times a week, Monday through Friday. So I do chair strength and tone, which is I bring barbells in, dumbbells, whatever type of weight I can use, bands. It's all seated, so then we work out different body groups. And then Janelle does cardio, which, again, you're using weights, but it's getting your heart rate up a little higher. So those are all offered. But the nice thing about the Wellness Center is there's so many classes for everyone. There's HIIT classes. There's TRX classes. So it kind of hits all spectrums of ages that are here. There's something for everyone.
Okay, excellent. And I have a feeling you mentioned you have a background in nutrition as well. That's probably very important.
Yeah.
We had Danielle on from a nutrition aspect, but it seems like you're kind of like the total package. Not to like look, but like being able to look at a patient as a whole.
Yeah.
Because everybody's gonna be a little bit different. Do you see that? Like,
Yeah.
Is that an important thing?
Yeah, 100%. That's why it's individualized. Especially like certain people have good aspects of not nutrition education. So certain people will know stuff, and then, other people will come in and not know what thing. And I think, again, that's the biggest thing about the Wellness Center, too, is like we just hired a new dietitian. So, yes, I have a background in nutrition. I can help with the gist of things. But even this morning, it's like, okay, you don't know anything about nutrition. You want help. I have a dietitian that's in here. I can send you right here instead of referring you out to someone else.
Okay.
So it is a big key part of it. We like to educate our patients as well as like show them different exercises. So it's a one package thing.
Excellent. Why'd you pick exercise physiology? What kind of led you into this career path?
Yeah, I actually went to school for medical, and I got scared right away. But then I remember reading a quote, and I was like, well, I'm not going to be anything if I'm not a doctor. Like, I want to help people. Mm-hmm. And then I remember reading a quote from a nurse. She's like, I decided to do preventative. It's not like a doctor, but we still can make a difference in people's lives to hopefully prevent them from going to the hospital. And so I seen this as a degree, started taking it, absolutely loved it. And I grew up, my dad was a strong man.
Okay.
So I loved lifting weights. Like, that's my thing. I would love to compete in a powerlifting meet. And then I know how I felt going into it, not knowing anything about it. And I had the stigma of, like, I can't lift weights, I'm going to get bulky. So I think I just wanted to share that love for lifting and everything else, and then it just progressed here. I didn't know I wanted to work with like an older population, but it's been the best thing ever, breaking that stigma and helping others along the way.
That's awesome.
Yeah.
Love to see some videos of your dad. Strongman competitions?
Yeah, with like the cars and stuff.
Oh my
and,
gosh.
like, the weird weights.
Yeah. Okay, I remember watching those as a kid, like ESPN from like the 70s.
Yeah.
You see some of that stuff lifting these large stones. Interesting.
Yeah, it was fun to watch.
So we have this new center. What is your favorite thing about the Now building that we offer? I don't say that other places don't, but what's special about the Now building?
I will say, I think what's special is the people that are here. We genuinely care. We want people to be happy. We want people to be healthy, but we care about your health. And I feel like me and Janelle admit that as well. If you've asked any of our patients, like, we check up on them daily, like their mental, their physical health. So I think that is the difference that you have here compared to like a Planet Fitness, where nothing against anything that they're doing there, but it's a bunch of younger kids. No one's there to watch you. Where here we have different avenues that we can help you meet your goals and keep you safe while you're doing it.
Seems like we're the complete center.
Yes.
Where we not necessarily they can get to physical therapy, but you have all these different areas where you go to Planet Fitness or Lifetime Fitness. They don't have all of those things to offer.
Yeah.
We have our tanning bed. Well, we don't care about the tanning bed. That's about the outward appearance, and that's going to give you skin cancer anywhere.
Yeah.
But, okay, excellent. So what's the best way for somebody to get in touch with you? If somebody wants to get an evaluation from you, do they need a referral from their primary care? Does it come to physical therapy? If they're a member of the gym, they just walk up to you and say, hey, I'd like you to evaluate me?
Yeah, either you can call up to the wellness center and either talk with our front desk staff, or they can transfer you up to us. I think a lot of people will come for a tour and they'll meet us face-to-face because it's more comfortable that way. We would love to meet you too. Mm-hmm. So if you'd like to come in, just come up to our desk. Like I said, we're there Monday through Friday from 7 till 3. We'd just love to meet you face-to-face. That way we can answer your questions up front and as well get you scheduled for an assessment.
Excellent. Kind of wrap up here. Is there anything else you want the community to know? Anything special about yourself or anything else you'd like to impart on us as we wrap up?
I think starting a journey is scary. So please don't be afraid. And I know it's the first step that's always the hardest. So like I said, come in and meet us. Take a tour of the Wellness Center. I promise that we can get you where we want you to go, where you want to go, and just help you live a better daily life.
Excellent. Well, Selena, I really appreciate your time today. So that brings us to the end of our episode here. Again, thank you to Selena Hafner for joining us. And as always, thank you for listening to Health Focus, our Memorial Healthcare podcast. If you've enjoyed our show, please rate and review us where you listen to your podcasts. And be sure to join us in the coming weeks as we'll bring you more interesting topics. Until then, this is Dr. Flermone, the voice of Memorial.